So I'm going to talk about how can we take up lasers in conventional treatments. So these are my disclosures. So if you're looking to like general laser treatments or light treatments for acne, there's no evidence that up to today any of those treatments work better than conventional treatments. We know that blue light actually works for mild but temporary results, so we can't have somebody under blue light forever. And the two things that we have some evidence is that PDT with high dose of red light works really well for acne. But I'm not going to talk about that now. I'm just going to move on to what is the conventional treatments. So we know that our patients, 11% of them actually have very difficult recalcitrant acne, especially women that can go through our lives into menopause with acne. We know that we have an increased antibiotic resistance, and iPLAD did not change the number of girls getting pregnant under oral retinoids. This is kind of scary. So there's plenty of studies that showing that iPLAD is just a bunch of paperwork, but really did not stop girls from being pregnant. Topical treatments suffer from the lack of compliance, so patients have to apply the topical treatments, and it takes a long time for first results, and some of these patients will stop using any conventional treatment. So what happens to, these are my patients, so what happens to this patient? So it's a 15-year-old with severe scarring acne with cerebral hypertension. There's another patient, 18-year-old, moderate recurrent acne, had 4 courses of Accutane, and still has acne and is bothered by it. He's trying to go to college, and he's really affected by his acne. And the worst of these patients is this one 14-year-old severe acne at the hospital in the suicidal ward. He just can't sleep. He can't lie down on the bed because he has severe pain. Cysts will bleed all over his backpack, so he doesn't want to go to school. So for these patients, we have basically nothing. And what you do for these patients, and nothing was never an option for me, and that's why we started developing some different alternatives for the treatments that we have conventionally. I don't know what is that. So this is not fireworks. This is I'm talking about selective photothermolysis. I'm so sorry. Can we just lower the sound a little bit? Okay, so compare the two treatments. So lasers, you will with the selective photothermolysis in 1726 nanometers, you will have much faster treatment. So in 3 to 4 sessions once a month, the patients will finish the treatment. It doesn't mean that the acne is going to be gone, but the treatment is over. Conventional treatment, you have a very long treatment. So initially for topicals, we were expecting some results in 12 weeks or even longer than that. And some people will have the conventional treatments forever. The lasers provide an office-based treatment. You can control all the variables. You're there right in front of the patient. You can control everything that's going on. And with the conventional treatments, you do not control. You do not know whether the patient took a pill or if they apply their treatment, and if they're not responding, what's going on. The things that against lasers, it can be painful. So you might need to use some sort of anesthesia prior to the treatment, and it can also cause anxiety. Some patients are really scared of going to the office and have any kind of treatment. And other conventional treatments can provide mild to moderate side effects. Some people can tolerate, some people cannot tolerate conventional treatments as side effects. But the good part of laser, there's no systemic side effects with that. So you are not afraid that these patients will have any problems in the long run. And some other parents are very scared about what's going to happen with their patients, with their children, if they're taking long-term courses of antibiotics or retinoids. The lasers at this point show a very promising long-term results. So we're talking about 12, 24, even 3 years post-treatment with the patients getting sustained response of the acne treatment. There's a lot of noise in the background. If you could please not make that noise, it would be very appreciated. And for conventional treatments, when we're talking about results, we're talking about 12 weeks of clearance. So every result you're looking on the FDA approval for any new drug, including the new drugs, we're talking about clearance of the acne in 12 weeks, so like 50%, 60% of clearance. For lasers, the bad part of it is that it can be expensive. You're talking about out-of-pocket treatments that can cost, for a lot of patients cannot afford to take those treatments. Conventional treatments are also expensive. It's just that they have the illusion they're not paying for it because somebody's paying. The insurance companies are paying. But if you don't have insurance, again, they can be very expensive, and it can add up. Every topical treatment with our antibiotics and so on. So we're talking about selective photothermolysis. So you see the curves of absorption of different chromophores on your left. On the right, so we see that we discovered the 1726 nanometers that is a higher absorption in comparison to the surrounding skin. The problem, if you look at this curves of absorption of the other chromophores, they are in orders of magnitude higher than water. And water is this tiny little speck of blue going over here. So they're not really competing with the remaining skin. But when we're looking at the 1726 nanometers, this is actually very crucial. We don't have a lot of contrast between the absorption of the lasers and the 1726 and the remaining skin. So the details really matter on this kind of laser. So there are two lasers on the market right now. It's not my role to compare them at this point, but there's, let's say one is using a compressed air chill cooling and the other one is using a contact device. And they are, again, they use the same wavelength, but they're technically different. In terms of clinical results, and so we're comparing this to conventional treatment. So the first thing I have to highlight, there's no comparison between these two lasers, and there's no comparison between lasers and conventional treatments. But we can think about is that all the FDA-approved drugs, we are talking about a clearance of 60, 70 at best. For any new drug that you can see at the AAD meeting for acne, that's kind of the clearance they say at 12 weeks. We're talking about using this laser, something about 80, 90% of clearance that is sustained and gets better over time. And so over like 6 months, 9 months, the patients are looking better than they look at 12 weeks. And this sustained improvement has been shown in both lasers up to 2 years of follow-up. So it's pretty remarkable. So we're talking about something that we wish, and this point we can only wish because we don't have data enough to support it, that this laser might be very similar to what we see with laser hair removal, where we actually have an optimal target that will be destroying and having a very sustained response. And then I think for us, we all like figures, so the figures are worth 1,000 words. So these are results after 12 months, another result after 12 months, results after 18 months after treatment, 28 months after treatment, 33 months after treatment, and this is with no other treatments, and this is a 2-year post-treatment. And this laser is color blind, so you can use in any type of skin with a very good result as well with sustained response at 2 years. There are histological evidence that they have destroyed the sebaceous glands down to 1.5 millimeters. And the other laser for a different company also showed some sustained responses at 3 months after treatments, 6 months after treatment, 6 months after treatment, 6 months after treatment, different darker skin type, and a 2-year after treatment. So we do have 2 new wavelengths of 1726. They are targeting sebaceous glands. As I said, we are trying to make a laser that is similar to the laser hair removal, but we don't know what's going to happen in the long run. So I think it's up for the companies and for the clinicians to tell me what's going to happen. So this is our hope. We have 2 new lasers that use same wavelengths, but they are technically very, very different. They use different strategies. There's no direct comparative studies using both lasers and any comparisons using conventional treatment. They are new modality treatment for those who have absolutely no other options. Those patients who have no options, what to do? Nothing. This is not something we can accept. The parents won't accept, the patients will not accept. We will have more to come as we learn more with these lasers as they go into the market and people have more experience in their hands. And then I want to remind everybody that treatment modality should be chosen by careful evaluation of each patient. So we can have this new tool that could work really well for some patients, but it might not work for some others. So I think we have to have an individualized approach for which kind of treatment. I do think it's a new thing that we can have in our clinic, in the office, and might help some more people. So with that, thank you very much, and this is what I have to say.